My name is Dr. Onuoha. I'm a consultant physician and pulmonologist. Vitamin D3 is a very important molecule. In fact, there is no body function or metabolism that it's not playing a crucial role in. And so, because of that, it's advisable to regularly check your vitamin D3 levels. If you take vitamin D3, what it does in terms of calcium metabolism, it increases the absorption of calcium and phosphate in the intestine and brings a lot of calcium into the blood and also help to regulate that level in blood. However, that is where the function ends. Vitamin K2 then activates certain proteins like osteocalcin and also matrix gla protein, MGP. Now, osteocalcin helps to mineralize the bone, while the MGP now mobilize calcium from soft tissue and also send them to the bone. So you can see that these two combination is very important. So vitamin D3 alone increases the vitamin K dependent protein synthesis. And this vitamin K dependent protein synthesis, they are not active until you have vitamin K2 in the system. So in spite of the fact that these proteins are high, the function that they are supposed to do will be left undone because you need vitamin K2 to activate them. And these are cardiovascular protection by removing calcium from the bone or preventing calcium deposition in the blood vessels, thereby reducing calcification of blood vessels and also leading to atherosclerosis and increased systolic pressure, like you find in the elderly. You have systolic hypertension. So with vitamin K2 preventing calcification of the arteries, you are less likely to have atherosclerosis and systolic hypertension. Now, also osteocalcin, which also helps for bone mineralization, and you have more bone formation and strengthening of the bone. So it is very important to combine these two vitamins, because if you don't have both of them, the endothelial function too, that vitamin D also helps. Endothelial functions of the arteries, which vitamin D also does well to improve, can have disruption because of increased calcium in the arteries without vitamin K2 presence. As it concerns bone, vitamin D3 and K2, they work together to help bone mineralization and also to increase bone density, thereby preventing osteoporosis and osteomalacia. It also prevents falls in the elderly because it helps strengthen their bones and also helps to improve skeletal muscle formation and strengthening in the elderly. And for cardiovascular, it improves endothelial function and also helps to remove calcium from depositing in the arteries, thereby preventing, as I said before, preventing atherosclerosis and systolic hypertension, which we find mostly in the elderly. It also regulates blood pressure by its influence on renin-angiotensin system activity. So it regulates blood pressure by working on that system. It's easier to notice differences in people who are actually sick. Okay, I've not been sick, but I will notice that there was a time I was not on vitamin D3 and K2, and it got finished and I didn't replace it for a long while. Then I went into a lot of stressful activity and eventually I broke down. And one of the symptoms I had, among other things, were respiratory infection, respiratory symptoms. Now, the illness went on for about 2 weeks. Then I remember when I was recovering, I started taking vitamin K2 and D3 on a regular basis. And it actually enhanced. Since I started taking it, I noticed that recovery was faster. And so that's what I would say I noticed by using D3 and K2. Yes, sometimes, you see patients who have also seen other doctors and and they come to you with their results. Sometimes they are x-rays, hip x-rays, and then you notice the osteoporosis, the thinning of the blood and of the bone. And look at what they are giving. They are giving other drugs, calcium and the rest, but there is no vitamin D. Or even if they give vitamin D, it's just only vitamin D, D3. So I now add K2 to their treatment. And within a few weeks, they come back to, you'll see a significant improvement. And usually by 5 months, 6 months, if they repeat the X-ray, you'll notice that there's significant opacity, enhancement of the bone, unlike before, the one they did before. That's one. There are patients with fibrotic lung disease that I noticed this tended to go on to maybe destroy lung syndrome, in a place where the lungs can no longer function properly. So I give them vitamin D3 and K2. I also add some other supplements and some other treatments if they're infection, antibiotics. But the antibiotics can only go on for maybe 2 weeks. But this other treatment, vitamin D, continues. A particular lady in my mind, and I started seeing that it was a post-tuberculosis case. I started seeing improvement in symptoms. Right? And then when we did X-ray, it was those opacities everywhere were lightening up, which means not only did it inhibit further progression, it actually reverse the case. So, and there's another person that have started the treatment now. Is also a post-TB case, because sometimes after treating TB, the fibrosis may continue. So vitamin D3 is very important in these patients. And there's a patient with breast lump, although it hasn't been identified because he was supposed to go to a surgeon where they will take the sample and then send for histology. But that was the point where she came to meet me. I put her on diet, fasting mimicking diet, some supplements, including vitamin D3 and K2. And in a few weeks' time, she called me that the lumps are gone. And this was sometime in the middle of last year. I even saw her in church yesterday. She's still free of the lump, and she didn't go back to the surgeon. So, and there's this feeling of depression. My son in Canada, when he was going, I gave him a lot of this, but over time he finished it. And then I saw that he kept having cold and all that. So I told him to go and look for vitamin D3 and K2. Fortunately, over there, they have vitamin D3 and K2. So he started taking them. And after a while, the thing stopped. What I also noticed was that he was having like a depression during the winter, sadness, mood swings, and all that. But the moment he actually started taking the vitamin D3 and K2 for the infection. Then he noticed that his mood swings disappeared. He was now feeling better because, it enhances the formation of serotonin and dopamine. And because vitamin D3 has receptors in the brain. So then his friend too, after a while, was also having the same thing. So, and I told him, why don't you tell him to go and get, or the one you have, give him. And when the young man started taking it too, the mood swing also disappeared. So these are the things that I can say, okay, those are my own experience with my patients. Now, vitamin D3, it enhances both enhances inflammation and also suppresses inflammation. So it modulates it. It promotes it when you have need for it, and then it doesn't allow it to go too much, excessive. Now, when people have COVID, for example, and certain acute viral infections, it is the inflammation that actually kill the people because there's no regulation. So, but for vitamin D3, it regulates it, and it promotes both innate immune system, that's the general immune system, and the specific immune system. So the monocytes and the macrophages are activated, and also it regulates the T cell function by enhancing the pro-inflammatory hormone and also by suppressing this pro-inflammatory hormone. It has a suppressive action on tumor necrosis factor, tumor necrosis factor alpha, and also interleukin 6. So by suppressing this one, it downregulates inflammation. And I remember during the time of COVID, a lot of my patients, I gave them these vitamins along with other things, and a lot of them did well. Particularly some cases in which, some people after the COVID, they kept having respiratory problems. And the issue was that they were forming a lot of fibrosis, a lot of inflammation post-COVID. And the treatment is just to give things that will downregulate fibrosis and all that, and inflammation. And they did well with that. People who are deficient in vitamin D3, they can have fatigue. Some of them can have bone pains, like in the back and hips and legs. And these pains usually, they are not, they cannot be, you can't point directly to something else that, okay, it's because of this or that, some kind of like mysterious pain. Now, also, you can have muscle weakness, muscle cramps, muscle aches. They can have things like hair loss. They can have mood swings, anxiety, depression, declined cognitive function, and poor wound healing. Now, these are the things that people who are suffering from vitamin D deficiency may have. Also, in severe cases, they can have things like rickets, especially in children, rickets, bow legs, and the rest. So, vitamin D deficiency have been significantly linked to cardiovascular problems. This is the brand I would recommend because this one is tried and tested. The one by Oaklife is a combination of vitamin D3 and K2, and the dose is 5,000 IU of D3 and 100 microgram of K2. It's tried and tested. I hear that there are new ones in town now, but we don't know their efficacy yet. But all the testimonies that I shared, it was this one that I've used. Thank you.